It's bad enough that air pollution can slowly rob you of your breath and clog your arteries. But what's now becoming alarmingly clear is that it can also quietly erode your mind, especially through its role in triggering strokes and stroke-related dementia. While Alzheimer's disease gets most of the attention in conversations about memory loss, vascular dementia, the second most common form, is a silent giant. And dirty air appears to be feeding it from both ends, first by damaging the cardiovascular system, and then by compounding the neurological injuries that follow. The path from pollution to stroke and dementia isn't a mystery anymore. It's more like a grim flowchart. Fine particulate matter, particularly PM 2.5, as well as nitrogen dioxide and ozone, are inhaled daily in cities worldwide. These pollutants pass from the lungs into the bloodstream, where they wreak havoc on blood vessels. Chronic exposure stiffens arteries, increases blood pressure, promotes clot formation, and triggers systemic inflammation. It's the perfect storm for stroke, especially in older adults whose vascular systems are already more fragile. And when a stroke hits, it doesn't just weaken limbs or speech. It often sets the stage for rapid cognitive decline. What's especially cruel about air pollution is that it doesn't wait until a major stroke to cause brain damage. Even before any clinical event, pollutants can trigger what's known as silent infarcts, or microstrokes, tiny blockages in the brain's small vessels that often go unnoticed but cumulatively destroy brain tissue. These lesions add up. Over time, they impair executive function, memory, attention, and spatial awareness. It's like slowly dimming the lights in a room, hard to notice day by day, until one day you realize you can't see clearly at all. And it doesn't stop there. Air pollution also directly damages the blood-brain barrier, that vital gatekeeper that keeps harmful substances out of brain tissue. Once compromised, the brain becomes more vulnerable to circulating toxins and inflammatory compounds. This allows the same pollution that triggered vascular injury to further inflame and damage neural circuits, amplifying the effects of any stroke or mini-stroke that occurs. It's a double hit. First the blood vessels, then the neurons. The result is a steep and tragic slope toward vascular dementia. Unlike Alzheimer's, which progresses gradually, vascular dementia can appear suddenly after a stroke, or in a more stepwise pattern as microvascular damage accumulates. It's often accompanied by depression, personality changes, and executive dysfunction, making it devastating not just for memory, but for everyday independence. And the numbers are climbing. As stroke rates rise globally, especially in polluted urban regions, so too do cases of vascular cognitive impairment. Studies now show a clear correlation between long-term exposure to air pollution and increased risk of both stroke and dementia. In fact, in some urban centers, even short-term spikes in PM 2.5 have been associated with a measurable uptick in hospitalizations for ischemic stroke, often followed by cognitive complications. One European study found that every 5 micrograms per cubic meter increase in PM 2.5 was associated with a 13% higher risk of vascular dementia. And because vascular dementia tends to be underdiagnosed, often mistaken for general aging or Alzheimer's, these numbers may vastly underestimate the true toll. This paints a grim picture for low-income communities and aging populations living in dense, polluted environments. They're not just breathing bad air, they're absorbing a cognitive time bomb, one that's ticking across multiple systems. The tragedy is compounded by the fact that strokes and vascular dementia are often preventable with better air quality, better access to health care, and earlier intervention. But environmental injustice ensures that those most at risk are the least protected. The good news is that change is possible. Cleaner air has already been linked to lower stroke rates in some regions, and as we understand more about how pollution affects brain vasculature, the case for aggressive environmental regulation becomes not just urgent, but neurologically necessary. If we can reduce air pollution, we can reduce cardiovascular damage. If we reduce cardiovascular damage, we can slow or prevent stroke-related brain injuries. And if we do that, we protect millions of people from losing themselves piece by piece. Because in the end, a stroke doesn't just hit the heart or the body. It hits memory, mood, speech, and identity. And when the air we breathe is helping to trigger those strokes, the responsibility to clean it becomes more than environmental, it becomes ethical. It's not just about lungs anymore. It's about lives lived clearly, or lost to a haze that never had to be there.